All right. Welcome,
All
and
right.
here we go.
All right. So once again, I'm Dr. Shruti Parisher, and we're going to talk about nasal congestion and sinus pressure. Like I mentioned, I moved down to Florida recently in 2020 to join my husband, who's also an ear, nose, and throat surgeon. He works over at Tampa General. And I've really been loving the Florida lifestyle. This is a photo of us sailing out in St. Pete, which is really close to my main office location. So in terms of ENT, I treat all types of ear, nose, and throat issues in adults and children. I've spent quite a bit of time at the Children's Hospital of Philadelphia, so I'm very comfortable treating pediatric patients, including newborns. But my particular area of focus within ENT is sinus, allergy, and voice issues. So I'd like to provide a brief overview of what we're going to talk about today. First, we'll start with nasal and sinus anatomy. Then we'll talk about rhinitis, which could be due to allergies or non-allergic causes. Next, we'll discuss sinusitis, and I'll also address how all of these conditions are diagnosed and how they're treated. So let's go ahead and start with the anatomy of the nose and the sinuses. The nasal cavity is divided into right and left sides by the septum that you can see here. It's a cartilaginous structure that ends at the back of the nasal cavity. So this area behind the septum is called the nasopharynx, and it's where the back of the nose meets the top of the throat. And it's one single structure because it's not divided by the septum. Okay, it's a midline structure. The curvy little bones that you see here are called turbinates, and they filter the air that you breathe in through the nose. And then we have the sinuses. So these are hollow air-filled structures, bony structures in the face that are paired. So there's a right and left of each sinus. The sinuses that sit in the cheeks, which are in purple here, these are called the maxillary sinuses. The sinuses that sit between the eyes in blue, these are called the ethmoid sinuses. And the sinuses in your forehead above your brow here are the frontal sinuses. And lastly, we have the sphenoid sinuses, which sit in the back of the head. And the symptoms of nasal congestion, facial pressure, runny nose, and postnasal drip can be due to inflammation that affects one of these structures, either the nasal cavity or the sinuses. All right, so first let's talk about rhinitis. And rhinitis is the medical term for inflammation of the nasal cavity, causing runny nose and congestion. So this figure on the left is a side profile of a normal nose. So these are the turbinate bones that we talked about, and they're covered in normal, healthy mucosa, and they're just kind of doing their job of filtering air. But on the right here, we have a patient with rhinitis. So you can see here that the pink lining of the nose is really red. It's inflamed, and it's also secreting a lot more mucus. So that is, this irritation and enlargement of the turbinates causes the sensation of stuffy nose and congestion. And the discharge that's produced, the excess mucus, causes the runny nose. So there's many different causes of rhinitis, and I like to divide them into two main types. We have allergic causes and non-allergic causes. Allergic rhinitis is due to environmental allergies. So what environmental allergies are is when there's some sort of trigger in the environment that causes an inflammatory immune response in your body. Basically, your body thinks that something like tree pollen, for example, is an invader. So the immune system starts to attack it, which causes inflammation. So these triggers in the environment, they can be seasonal, such as grasses, which occur in the summer, weeds that are mainly in the fall, and trees, tree pollen, which occurs in the spring. Or the trigger can be present year round. That's called a perennial trigger. And that's things such as molds or dusts. So the main symptoms of environmental allergies, you experience them in the mucosal surfaces, or the surfaces that are covered in some sort of, wet type of lining. That's things like your mouth, your nose, your eyes. These are where these mucosal surfaces that are most likely to come into contact with the environment, that's where you experience the symptoms of environmental allergies. So that would be the nose, the eyes, and the throat. So in the nose, these environmental allergies can cause nasal congestion, runny nose, itchiness, and sneezing. In the eyes, they cause red, watery, itchy eyes, and they also can also cause what's called allergic shiners. Here you could see these. This is like dark discoloration under the eyes that look like bruises. In the throat, they cause a lot of scratchiness. They can cause a hoarse voice and a sore throat. So the main way to diagnose allergies is through testing. The gold standard, the best way to test for environmental allergens is through skin testing. So this is when very tiny amounts of the allergic trigger are deposited onto your skin and the reaction is measured. So you could see here, this is how those allergens are deposited onto the skin. And these are the little kind of raised areas where the allergen has been injected. So this is the best type of testing because it actually looks at your body's response to the trigger. There's also blood testing for allergies. This is I primarily like to use in patients that aren't able to have skin testing for one or another reason. It could be that they're on medications that would interfere with the skin testing. It could be that they're pregnant or that they have various skin conditions that make the skin testing not reliable. So the blood test measures the level of antibodies or immune responses that your body produces, that your blood produces when it's mixed in with these triggers. Okay. So the treatment for allergic rhinitis, it's best treated with a combination approach. So the first step of this is once you know what your main triggers are, which you can find out through allergy testing, the best thing to do is to try to avoid interaction with those triggers. So if you're allergic to cats, for example, try to avoid cats. If you have a cat, then don't allow it into the bedroom. Okay, because that's one place where, because you're lying on your bed in constant contact with the sheets, that's one place you can have, a lot of exposure to the cat kind of environmental allergens there. If you're allergic to oak trees, for example, try to avoid the park that's full of live oaks. The next step in treatment, the next line is going to be medications. And these medications are designed to treat the symptoms of allergies. So they're steroids, nasal steroid sprays, things like Flonase, Nasacort, etc. And these decrease inflammation in the nose. There's also nasal antihistamines, such as Patanase or Astelin, and these block histamine in the nose. So histamine is a signaling molecule that plays a major role in allergic inflammation, and it's primarily known to cause itchiness. We also have oral antihistamines. These are things like Allegra, Claritin, Zyrtec, and Benadryl, and these block histamine throughout the body. And we also have leukotriene inhibitors, which are another, block another major signaling pathway in allergic inflammation. Finally, we have immunotherapy. So this is the only form of treatment we have which actually treats allergic inflammation in and of itself. It doesn't just treat the symptoms. So what immunotherapy does is essentially introduces small amounts of the environmental triggers to your body over a long period of time so that your body can become adjusted and eventually stops mounting an immune inflammatory response against the triggers. So there's two different types of immunotherapy. They can be administered via drops that are just applied under the tongue, or allergy shots, okay? So immunotherapy is a really good form of treatment for severe allergies, but it takes a lot of patience because this is something that needs to be done over the course of years to be safe and effective. So next, let's discuss some of the non-allergic causes of rhinitis. So non-allergic rhinitis can be idiopathic, which means that there is no definitive cause. This happens in about 60% of the cases. It can also be due to irritants. So irritants can be things such as tobacco smoke or a specific cleaning product. And the irritation is different from allergy because it's not necessarily an immune response. It's just irritation of the tissues themselves. Next, we have hormonal causes. So hormonal rhinitis is very common, especially during pregnancy due to all of the different hormone shifts. And finally, we have another common cause is vasomotor rhinitis. This is when the nose runs in response to changes in temperature, or it can run while eating. And this is due to overactivity of certain nerves in the nose that are supposed to just kind of moisturize the nose in normal times, but can be oversensitive and cause runniness. So the treatment for non-allergic rhinitis is pretty similar to the treatment for allergic rhinitis. If possible, if it seems like it's irritation related, we try to pinpoint the irritants that can be causing the issue in order to try to minimize the exposure to those irritants. We can also recommend saline rinses or doing a neti pot, which can be very useful, especially after exposure to the irritant, to just kind of wash out the irritant from your nose. And for vasomotor rhinitis, there's a couple of specific treatments. There's a specific spray called ipratropium bromide. It targets the hyperactive nerve in the nose that's causing this runniness. And then if the ipratropium spray works well for a patient, I offer them a procedure called Clarifix or Rhinair. This is an office procedure that uses cryotherapy or cold therapy to ablate the signal coming from this nerve here that can be causing the oversensitivity and runniness. So that's an option for patients with vasomotor causes of runny nose. All right. So now let's move on to sinusitis. This is inflammation of the sinus cavities. It differs from nasal inflammation, but it can be related, and it's definitely possible for patients to have both. So sinusitis comes in two main varieties: acute, meaning short-term, or chronic, meaning long-term. And the main symptom of sinusitis, and the one that kind of differentiates it from rhinitis, is facial pressure or the sinus headache. So the other symptoms of sinusitis are going to be nasal congestion, the facial pressure like I talked about, and this pressure is primarily going to be in the distribution of the sinuses. So along the forehead, between the eyes, and in the cheeks right below the eyes. There's also decreased sense of smell, productive nasal secretions. That means like thick mucus. It can be any different color, but the thickness is really what we're looking for, as well as sometimes fever, and oftentimes, especially in patients that have long-term sinus inflammation or chronic sinusitis, they can have fatigue. So first, let's address short-term sinusitis or acute sinusitis. This is primarily an infectious problem. So it can be due to a viral infection, which typically lasts less than 10 days, or it can be due to a bacterial infection, which can last, typically over 10 days. But overall, the symptoms of acute sinusitis last less than a month. And these are the symptoms we talked about: the discharge, the congestion, and the facial pain. The primary treatment of acute sinusitis is going to be different depending on whether it's a viral infection or a bacterial infection. And sometimes that can be difficult to distinguish unless you kind of wait it out and see how long it lasts, unless you're able to see an ENT. which I'll talk a little bit more about later on. But the viral infections are primarily treated with steroids to decrease the inflammation, as well as saline rinses to wash out some of the viral burden, as well as the excess mucus and things. And bacterial sinusitis are treated primarily with antibiotics and also saline rinses. So next, we'll move on to chronic sinusitis or long-term sinusitis. This is when symptoms last over 3 months. So it's a process that can start with an infection, but the primary driver is inflammation. So the main symptoms of chronic sinusitis are pretty similar to acute sinusitis. It's thick drainage, congestion, facial pressure, and decreased sense of smell. This problem of long-term sinus inflammation is often associated with obstruction or blockage of the normal sinus drainage pathways. And this can be due to polyps or due to inflamed bone. Like I mentioned before, inflammation is the key here. So chronic sinusitis is something that can't just be treated with antibiotics. We really need to address the underlying inflammation and possibly also the underlying obstruction or blockage. The best way to diagnose sinusitis is by looking in the nose with a camera. So this illustration right here illustrates a rigid camera. I most often use a flexible camera, a thin flexible scope in the office. So using some sort of camera to look at the sinuses, we can see if there's polyps that are blocking the drainage pathways, which would be indicative of something like chronic sinusitis. Or we could see if there's pus draining from the sinuses, which points towards an acute sinusitis due to a bacterial infection. So like I had mentioned before, this is the best way to differentiate between a viral or a bacterial infection without having to wait the full 10 days to see if the symptoms last. By using a camera to look in the nose, I can see if there's pus draining, which would mean that it's a bacterial infection and I'd start antibiotics, or if it's just kind of clear, thin secretions and a lot of irritation, which would mean that it's a viral infection, and that I would start you on rinses and steroids. So for sinus symptoms that don't improve with antibiotics and steroids, the next step is to get a CT scan, and this allows us to actually look at the full sinus cavities. And this image on the left is a sinus CT scan. So it's a very abnormal one. So let's start with that. But basically, it would be like looking at the face in a mirror. So this is the right eye, this is the left eye, and this is the nose in the middle. So normally what the sinuses are supposed to look like is a little bit like this. It's supposed to be a thin layer of white, which is bone, right next to black, which is air. As you can see here, this maxillary sinus on the left side is completely gray. That means it's blocked with something. It could be pus, it could be polyps, it could be backed up secretions because this drainage pathway here is obstructed. The ethmoid sinuses that sit between the eyes are also completely blocked. And there is some mild blockage or mild thickening of the maxillary sinus on the right. So the sinus CT scans that I get are performed in my office, and they're very similar to a dental x-ray. So you're sitting up like illustrated here, and the scanner just rotates around the head. It doesn't feel nearly as claustrophobic as a traditional CT scan. And it's very quick. The images take about, less than 5 minutes. So the main treatment for chronic sinusitis is to treat any associated allergies. Like I said, oftentimes there's also nasal inflammation that goes along with sinus inflammation, and frequently that's due to that rhinitis is due to allergies. So we treat the underlying allergic inflammation. We start the patient on rinses for the nose. This is like the neti pot saline rinses. And then most often, we also have to open the sinus drainage pathways in patients with chronic sinus inflammation. So there's two main options for opening the sinuses. One is balloon dilation, which is shown here. It's an in-office procedure that I do. Whoops, go back. It's when I pass a little catheter through the sinus drainage pathway and then advance a balloon and inflate it. So you could see the inflated balloon here. And what that does is it expands and dilates the opening, the drainage pathway. So it's a procedure that I can do in the office, and I use local anesthesia to numb the nose so that you don't have to be put to sleep under general anesthesia. And it tends to have a fairly short recovery period of several days. The other option to open up the sinuses is what's called endoscopic sinus surgery. So that is a surgery that I do in the operating room, and I use cameras and instruments through the nose to fully open up the sinuses. This is the type of procedure I prefer to do, and I typically recommend for patients with more extensive sinus blockage. So in those patients, I prefer to do the full sinus surgery. In patients with slightly less sinus blockage, I prefer to try to do the balloon dilation because it avoids the anesthesia. So let us summarize what we've talked about today. We've talked about sinusitis and rhinitis, which are inflammatory conditions that affect the sinuses and the nose, and they can occur individually or they can occur together. And they both cause some overlapping symptoms, so they can be a little bit tricky to tease apart. So these conditions can be diagnosed through a careful history and exam. However, that should always be confirmed with endoscopy or looking at the nose with a camera, as well as allergy testing, and possibly also a CT scan if there's concern for sinus blockage. In most cases, these symptoms can be managed with medications. If the medications aren't helping, however, especially if you've tried some over-the-counter medications, or if your symptoms are lasting longer than a month, then I would definitely recommend you to see an ENT. We can offer more options for prescription medications. We can perform allergy testing and also discuss any in-office procedures that could help get your symptoms under control. All right. So any questions? I'm going to get out of this screen so I can see if there's any questions coming up in the chat.
All right, we do have a couple of questions.